Dr. Tan said that balance method always works. And believe me, balance method always works. It doesn't work if we don't do it right, if we make mistakes. So now we're going through the subject where most of us make mistakes. We don't make mistakes in the balance method systems, which we will learn later, but we always make mistakes in projections. So as we discussed earlier, according to Neijing, 2,600 years ago, there is a projection of human body to the human face, and it's very meticulously described. As we know, there are projections between system of correspondence between ear, according to Nogier, and human body, between palm, Sujok acupuncture, and human body. Reflexology is a correspondence between the foot and human body. When we do ear acupuncture, you must be so precise, because if you don't precise, 1 mil left, 1 mil right, you are not on the liver, but you're in the stomach. Ear acupuncture is absolutely brilliant method of treatment, but you must learn it well and be very precise. In balance method, we look for correspondence between limbs and human body. And Dr. Tan defined two projections. One is a mirror, and another one, so-called, is image. And now we'll take a look closely what the image and the mirror is. If we want to treat the right arm, according to balance method, we never place needles into the painful place, right? So we must treat another limb. So what we do? We project the painful limb to another limb. So the mirror is the system of correspondence between limbs. We define two possible solutions: the direct mirror and reverse. What is the direct mirror? We project a limb onto a limb as they are. We can project the arm to a leg, the arm to another arm, or vice versa, leg to a leg and leg to another arm. So, if someone has pain, let's say, in the palm, we'll project this arm, the left arm, to the right arm, and we will treat the corresponding meridian on the right palm, not on the left, where the pain is. Or we can project the left arm to the right leg. So the palm will correspond to a foot. Always opposite side. Can we project the left arm or left palm to the left leg or foot? No, never. Always opposite side. But imagine someone has problem in the hip, and this lady or gentleman are quite choppy, so the size of the thigh is very big. We palpated, we found the right meridian, so we need to find the corresponding meridian on another limb. So we will look for another shoulder, for example, or another thigh if we do the mirror. So we project the thigh onto his thigh. And we must find the right points and right meridian there. But it's very difficult because there are a lot of flesh. And it's so difficult to be precise. The balance method is about precision. So what can we do? We reverse another limb. So the thigh will correspond to the ankle. The upper leg will correspond to the lower leg. And the lower leg will correspond to upper leg on the left hand side. And the metatarsals will correspond to hip. What happens if we project the leg to another arm, but we reverse the arm? So that will be absolutely the same. The hip will correspond to the wrist. The upper leg will correspond to the lower arm, and so on. Easy? So this is a reverse mirror. And now, more complicated case. If the pain is in the body, not on the limb or in the head, what do we do? Image. We can project the trunk, for example, or the whole body to the arm as it is. Let's project the trunk first. So this is a trunk, and let's project it to the arm. So the chest area will correspond to the area of deltoid, this level. The level of the waist will correspond to the elbow. All the gynecological area will correspond to the lower arm area around P6, and also gynecological area will correspond to the palm also. And look, if I ask you what's the best point in TCM to treat all gynecological disorders? P6, pericardium 6. So pericardium 6, according to balance method, corresponds exactly to the area where the womb is. And the same happens if we project the whole body, whole trunk, to the leg. The upper part, that will be the upper leg. The area of waist is the knee. The lower part and gynecological part is the lower leg and ankle. And now see, again, what's the best point to treat gynecological disorders? In acupuncture, we will always suggest it to use it. Spleen 6. Spleen 6 corresponds to the area of uterus because it's a low belly if we project the trunk to the leg. Again, image can be direct, and we were talking about the direct projection now, but also image can be reversed. So what we do in this case,